All right, this is going to be the story of the time I interrupted a suicide. This is educational in nature. So hopefully this doesn't get blocked or something like or age restricted. But I am a medical provider, nursing assistant, home health aide, EMT, all that stuff. I mean, I could list everything if you want, or you could just check the description. So I used to work at a assisted living facility that also had a memory care in it. And if you don't know what a memory care or an assisted living is, it's kind of a step below a nursing home. Think of a nursing home as like the place that people go when they're kind of at the bottom of the line or they need short-term care for therapy. They're there for a period. Assisted living is a little different. Assisted living is more of they're more independent. They can do more on their own. They just need help with a couple things usually. But we also have individuals who need help with almost everything and probably should be in a nursing home, but this is how the system works in healthcare. They will accept people who need to be in a nursing home instead of an assisted living because we don't have the full resources that a nursing home does, but they'll still accept them because it increases the company's census. They get more money because they have another person living there, right? So, you know, and that was rampant across the company I worked at. There were times where we went on break or sorry, we weren't allowed to take our 30-minute break because we didn't have time, and they would still take it out of our paycheck. And we did sue for that, and we actually won a class action against that. So on to the story. An assisted living, you basically help people out with their activities of daily living, ADLs, walking, bathing, eating, uh, taking medications, just general, taking vitals, evaluating conditions, all kinds of, really as a as an aide, you're the first person to really respond or know what's wrong because you deal with these people all the time. And so on the assisted living side, it's pretty easy because it's basically just you take care of people. I love AL, and I can't say I don't like memory care as well. I love memory care. I have a fondness for it. I have a fondness for those with um, dementia, Alzheimer's, organic brain disorder, whatever you want to fucking call it. Uh, I think that there is a beauty in being able to redirect someone who is confused and doesn't know exactly what's going on and redirect them into a mindset that's better. I mean, that takes skill. That takes a lot of practice. Um, and memory care is in the most respectful way. If I am trying to explain it in the simplest way possible, it is taking care of adults that kind of have the mindset of children. And that sounds bad, but think about this, okay? They wander. They do a lot of things because of this disease, disorder, whatever they have, because dementia tech isn't a disease, it's an umbrella group of symptoms. But it impacts them to the point where they don't act like a normal, 80, 70, whatever year old person would. And so it really the best way to describe it is taking care of children and adult bodies. But I never saw it that way, every person is unique to me. People would ask me what I did. I told them that I have the world record for grandmas and grandpas. So it really depends. You got to frame your mindset. So one day, um, we had a patient. I'm not giving any identifying information, nothing like that. So it's not against HIPAA for anyone that's about to say that. This individual could walk on their own with a cane. They actually had escaped through a fire exit. and ran through a field. I had to chase him. A couple weeks before this incident I'm about to tell happened, and I said, "Where are you going?" And they said, "I'm going north." And I thought it was funny because I ended up looking what direction we were facing, and sure enough, this guy was running north. I'm I don't know. He just said, "I'm going north." I mean, he was going towards woods and like a big ravine, so good thing he didn't keep going. But he said he was going north, and he I don't know if it was the stars or what, but he went north. He could walk on his own. He could communicate properly. Like I said, he was going north. He could feed himself. He could have, basic conversation, not too comprehensive, but basic conversation. Um, and he could do most of his activities of daily living himself. He just really needed assistance with some of his hallucinations from Parkinson's, end stage Parkinson's, and mixed with dementia. It's very, very common to see hallucinations. Think of schizophrenia and all that. The dopamine is the neurotransmitter that really controls these disorders. Parkinson's and schizophrenia, they're on the opposite spectrum. So when you are kind of at the end of the life cycle, they come together, and they're very similar. So, anyways, this guy, he had a nice room. His family really set him up. They gave him a like flat screen TV, a radio. He had a CPAP machine. He had a tablet with a braided charging cord. Um, he had his own mattress, which is pretty insane. Like his own, um, like bedspread, all kinds of stuff. So the family had him set pretty good, and that's awesome. We have a lot of people that don't have the family set, and it's not. It sucks. Um, this ended up becoming a disadvantage, though. So one day, I've already described what this person can't do and how they were. Nice guy. Had lost his wife to COVID. This was in a couple years ago. I can't say the exact year, but it was in the beginning of the COVID period. Okay, a little bit after COVID started. His wife had died from COVID earlier in the year, and so he did have depression because of that. And then on top of that, being taken out of your house and kind of put in a assisted living is not good for anyone. But one day, he was there for about 2 months before this happened. And one day, we were at dinner time. I worked the second shift, so you come in at 3, you leave at 11:30. We're there. I'm on my shift for about 2 hours, and we start dinner. And I remember that the patient got up after eating. He ate pretty quick, but then again, you usually have to direct these individuals to eat or help them eat. So he went, after he got up, he went over to every other patient. We had about 18 total in the memory care. That may not sound like a lot, but one CNA and one nurse for 18 people is a lot. He went to every patient and said, like, "Thank you," and like, "I appreciate your kindness," and apologized to them for anything he may have done. Okay, so as a CNA, you always are, you are the one who interacts with them the most. You may not be a doctor, you may not be a full nurse, but you're the one who interacts with them the most. You are around them the most. You are doing most of the healthcare that they need, unless it's to a higher degree. Then the nurse comes for maybe 5 minutes to administer or something, turn on the oxygen. But that's it. Then it's just you again. You know these people. And this individual, it's abnormal for him to even talk to other people, let alone go from person to person and you know, uh, apologize for anything he's done. And then he came up to the nurse and myself and thanked us for helping everybody and just being here, like our job. Um, and the nurse was like, "Well, that was really sweet." And I'm thinking to myself, I mean, yeah, it was sweet, but that's not normal. That is not normal. So this guy, after doing that, he gets up and he's going towards his room, and so I obviously identify that as something not normal for this individual. And so I'm kind of slowly following him to his room. Now we keep a set of keys for all the doors in case there's an emergency, but they're able to lock their doors, shut them, all that stuff. Um, Most of them don't though, because when you have dementia, Alzheimer's, I've noticed a lot of memory care, and anybody in the comments that also works in memory care, prove me if I'm wrong. But one thing I've noticed, people in memory care don't close their bathroom doors if they're going to the bathroom and they're in their room. Um, they just, I don't know, they just don't. Another thing is, um, not only do they not close their bathroom doors, they don't lock their doors, and sometimes they don't even check to see, and I don't know if that's part of the disease or they start getting used to it and think it's home, so why shut the door if I'm home alone? Um, but a memory care individual doesn't shut their doors, in my experience. Very, very uncommon for them to shut their bathroom door while they're actually going to the bathroom. So I go to, I'm following this patient. He goes in his room, shuts the door. And so I'm waiting a couple of minutes because I don't want to just barge in and stuff like that. But I am concerned about this changed behavior and I need to investigate it. And so I wait about like 2 minutes. I'm kind of talking to the nurse, talking to another CNA on the assisted living side. The nurse said, I'm going on break. If you need anything, let me know. And then another CNA from assisted living side came over because they get two people over there, which, I mean, yeah, you're taking care of 50 people, but that's still 25 per. Still a lot. Anyways, well, no, we did like 1 through 28 and then 29 through 50. So technically, whoever was 1 through 28 had more people. So nurse goes on break. Got another CNA that comes and helps me for the duration while the nurse is gone. And I tell this CNA, hey, I'm gonna go check on blah 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 because they're not acting properly. They did this, and I'm concerned about their well-being. And so I go to the door. I try to, I knock and then try to open, and it's locked. So this is just the outside door. Okay. Some memory care residents do lock the doors. This guy, he usually didn't. Um, so okay, another red flag. The first red flag was his behavior at, well, I mean, we could talk about the red flags, the depression in the past, him running off, um, mentions of not wanting to be around. Those were red flags too, and those were reported. He was being treated with, outpatient depression meds. They weren't doing it aggressive enough. So, door's locked. I use the master key, open it up. Um, and there's like a couple books on the floor kind of blocking the opening to the, like, trying to wedge the door, but like they don't exactly think in the fullest extent. So what he thought may have stopped me from opening the door was just quite literally an easy push. But he did put these books in front of the door trying to kind of like barricade himself. And so there you go, another red flag. I go in and the room is empty, but the bathroom door is shut. And I could see the light on and the little crack underneath the door there. And um that's the next red flag, because especially this individual, but not just this individual. Um like I said earlier, and comment if I'm wrong, in my experience, memory care individuals, they don't close their bathroom door even when they're using the bathroom or taking a shower. I don't know why. I have my theories, but the bathroom door's closed. I Oh, there's no locks on the bathroom doors. There's only locks on the main outside door. So I open up the bathroom door, um, and the guy had grabbed up one of his braided charging cables for one of his devices that his family had given him, and he tied it to the top of the shower ring, the the rod, whatever you want to call it, um, which was fixated inside. It was kind of mounted inside the wall. And then the other part was around his neck, and he was um, kind of like you have to step into. We have flat surfaces and then tubs where you have to step over. He had a tub version because of his mobility. He was good at, he was pretty good at mobility, so he had one of those, and he was standing on the part you would have to step over for the tub. So he's standing on the edge of the tub, and the other part of the wire he was wrapping around his neck at that time, and he was actually putting it in a tie. And so I immediately went to him, and I said, his name. I said, "What are you doing? What are you doing?" The first thing I did was I took it off of the curtain rod because I didn't want him to fall and then that not work, and then we're in a bigger situation. So took it off the curtain rod, got him down. We carry radios around um, to talk to each other in case there's an emergency, obviously, and like this. And I didn't exactly freak out, but I called over the radio. I said, I need help in here. I got someone who just tried to, you know, and we're not supposed to say exactly what's going on over the radio, but in the moment, I don't know. I didn't know what else to say. I said, we got a guy that just tried to kill himself in this room in memory care. So the nurse is still on break. The other CNA comes in. I'm unwrapping the shit around his neck. I'm talking to him. The CNA is calling 911. The other CNA, and I'm just kind of, you don't want to force anything out of him. This is a delicate situation, and the only thing I really asked was, why, man? Why'd you do it? Why? There, you could have. There's help. You could get help, and the only response that I got was, "There's no help for me. I just don't want to be here anymore." And so brought him out to the main area by the nurse's station, went outside, found the nurse on break, made her come in early because of the situation. Paramedics showed up. They showed up hot too, and they didn't really have to, but they did. They showed up very hot. I mean, they were rapid fire. I already had full set of vitals, did a neuro check. He was good. He never got the chance to actually initiate his plan like fully, but he was getting there, and I'm glad I was able to put myself there. Now paramedics come, they take him to a local geriatric psych unit. He's there for about 2 weeks, and now I told you his functionality in the beginning. He was able to walk on his own, feed himself, small conversation, bathe himself, do general tasks. Just need a little cueing with memory. Occasionally, a little more than that, but he comes back from the psych unit 2 weeks later, bedbound. He can't talk anymore. Can't walk. He can't even really roll over on his own. Can't go to the bathroom on his own. Couldn't feed himself. They put him on so much psych meds that they made him bedbound. And that's quite literally what happened. There's no mistaking like, oh, something else caused it. No, I saw the med list. It was like Seroquel mixed with like Remeron, mixed with like an SSRI. I mean, they had, and this is for an elderly with dementia. Like all of these are counterindications, but this guy did just try this attempt. So, what are you going to do? But The family, I spoke with the family. The family told me they appreciated everything and that it was heroic, which I don't see it as heroic. I'm just doing my job. Um, but they said that they know it's his time to go. And I remember this vividly. We were right in front of the nurse's station, and his daughter was there, and I was right next. I was with him, and sorry, I'm trying to hold it together here. She said, "Dad, we know it's your time. It's okay to go be with mom. It's okay to go. You don't have to fight anymore." And we eventually put him on hospice. And 2 weeks after being on hospice, he slowly passed away. And I was a part of his hospice care as well. After that incident, I started having nightmares of walking in and him getting further than where he was. I had thoughts of, what could I have done better? What did I not do? What did I do that could have caused it to go worse? And I had to take a long break from healthcare after that. Um, about a year and a half, I took a break and quite literally was unemployed because that situation, I wasn't prepared for it. You could go through all the training in the world, but I feel like if I was a part of one, like his hospice care or the event itself, one or the other, it would have been easier, but both, and then all the way till the end, and then, being there when he passed away, it's put something through me. It still does to this day. Um, that I just don't know how to explain. I've talked to many people, other CNAs, nurses, other EMTs, home health aides, talked to doctors, psychiatrists, nurse practitioners, respiratory therapist, anybody who will listen. And everybody tells me that you did everything you could. There's nothing else you could do in that situation. You reported the issue. He was already on meds for the depression. You noticed that he was acting different. You responded to that behavior change, and that's basically your job, and it is. But I felt like there was something more that should have been done to, I guess the word would be, save him. But I've slowly kind of learned to realize that there's nothing that could have saved that individual. They had already made that decision in their head. They had already, the conclusion was already made for them. It didn't matter how it was going to end. It just was and it was going to happen soon. And I did everything I could in my power. And at the end of the day, it's still something I think about, still something that gets to me. But I'm back in healthcare, obviously. And I don't think I would trade helping people for anything, but it is insanely unique that I feel like I have to explain that I did everything I could in a situation like this. You can't plan for something like this. You can only adapt to the changes, and I guess that's what I tried to do. But I eventually did go to the individual's gravesite because, and that's why when I was taking a break from healthcare, because I really needed some closure. And I went and I talked with him. He was buried with his wife, and I talked with him about 5-10 minutes. I felt an amazing, overwhelming feeling of relief after talking to him at his grave, at his cemetery site. And I told him, I said, I'm sorry that you felt like you had to do that. I'm sorry that you felt like that was the only option. Um, and I'm not sorry that I interrupted it or stopped it, but I am sorry that this had to be this way. And it really brought closure to me personally, just speaking to him, if that's what I call it. I don't care if he's in the ground or not. I'm still speaking to him, still talking to him directly, telling him how I feel, and so he knows. And I hope he understands, because I'm still trying to understand here. But if you listen this long, I appreciate it. Just something I thought I'd give my story on. Have a good day. Remember that people like hot fries. When you bring service to someone, always bring great service every time. If you bring soggy fries, they're gonna switch restaurants. Always bring your hot fries.